Hi everyone, and welcome back to another episode of Design to Move. My name is Ryan Maxwell with Fluid Health and Fitness, and today we have a special guest with us.
Hi guys, I'm Ashley DeBoer, Doctor of Physical Therapy. I work at Pure Strength and Pure Yoga.
And back at it again, Hunter, the looks.
Yeah, the beauty of the group.
Yeah, right.
There we go.
So today, guys, we're going to talk about another muscle distortion pattern, or movement distortion pattern called swayback or excess lordosis. This creates a lot of pain in our backs and knees and hips. We want to show you guys how to get rid of it. And as usual, each week we go into another movement dysfunction or force-couple relationship imbalance in the body, show you how to correct for it. So if you want more information on tonight's topic or any of the other series that we've created, reach out to us at fluidhealthandfitness.com or
pureyoga.us.
So once again, if you have questions, you can go down into the blog, down in the description below. Click on that link. It'll send you over to a more detailed explanation of what we're going to go over in the video tonight, and we hope you like it. So let's get started.
All right, guys, so you might be wondering why we don't have any shoes on and why you get to look at our pretty feet.
Yeah, so we are actually gonna break it down and talk to you about what happens at your foot and how that's related all the way up the chain into your back. So you might be watching this with back problems or even knee issues, whatever it is. We're gonna help you see the bigger picture about the role of the feet. So if you think about your feet have to hold up your entire body, right? So if my arches and my feet are not strong, what's gonna happen? They're gonna cave in. That's gonna cause this to cave in. That's gonna cause all of this to rotate and cave in, and that's gonna affect my back and my posture. So if you're looking from the side, you may see someone like our beautiful model here, who is way out of alignment. So ideally we want his head and his shoulders over his hips, over his ankles, right? So go back into that poor posture like you just had. So as you can see here, he is having his hips back, okay? And his back is kind of overarching. He's locking out his knees. His feet are actually having no control left in them, and he's way out. And then the opposite of that, let's see the other one here. So now, he is trying to compensate for a lack of probably stability somewhere or mobility, which we'll get into. And you can see he's pushing his pelvis forward. Again, he's out of alignment. He's just hanging out on those hips and those hip ligaments. Really not good for your back or your hips or the rest of your body. So we're gonna break it down for you and let you know what you can do to prevent this or get rid of it.
Remember, guys, this is a 5-part series. We're going to go into 5 different activities. We're going to show you how to release some of the overactive muscles down by the ankle called the peroneals. We're going to show you how to use a soft tissue technique using our fast release ball to get the job done. Finally, we're going to go into a stretch of that. Once we've inhibited those muscles, we want to see if we can get more length out of them. Then we want to work on the muscles that are deficient in that base of support in our feet. It's called the abductor hallucis muscle. From there, we want to learn how to stabilize the foot and the hip together. A lot of people don't recognize the importance of actually stabilizing the foot and the pelvis concurrently and how they work basically as teammates, right?
Definitely.
So once we're done with that, we want to work back on the old core, throw that around a lot, but basically we all need to do more of it. So we're going to focus on strengthening the transverse abdominis. That's going to help to maintain the level of our pelvis so we don't have this, swaying of the hips and keep our center mass right up over our feet, right?
It's awesome.
All right, let's get right to it with the first release.
Sweet.
Let's go.
Okay, so we're going to start with a soft tissue release of the peroneal muscles. And these guys are responsible for what at the ankle and the foot?
Yeah, so this is a really actually important muscle that not many of us know about, right? So basically, if you're looking at someone, it is this muscle right here, and it goes basically from just below the knee to the ankle complex. And what it does is, on its own, it brings the foot up and out when we walk, and when it's tight or when there's issues there, it can change the complete mechanics of how you walk. So it can change something at the ankle, all the way up to the knee, to the back, and all the way up the chain, really.
Yeah. So overuse of that muscle can distort the way our body interacts with the ground, how the rest of the muscle groups actually function from that point forward, and obviously affect our gait and lunging and all sorts of different exercise activities. So if we really like to stay active and then we don't correct for that, it could lead to some serious things down the road, huh?
Definitely, yeah. And a lot of people don't even realize that that's tight or painful or that there's trigger points in that until they start to use a ball or something to kind of check it out and get into that muscle group as well.
Cool. So tonight we're going to do that. So everybody, we're going to get down. Make sure you have a fast release ball. If you don't, you can go online and click on the link and we can get you set up with one. Let's get right to it.
Awesome.
Yeah, so what we're doing here is a technique using the ball to release that perennial complex, that muscle we were talking about. So as you can see, he's in a position where he's holding his body weight up to a certain amount, and the ball is actually just on the outside of that ankle, all right? And then he's working it up slowly towards the knee until he finds a spot that is tender, which means it's tight.
He's got it.
Right? And then, so he's found his spot, and you have probably found yours as well. And you want to hold there with the pressure on that area for about 30 seconds to allow that area of tissue and muscle to release and relax. How's it feeling?
Yeah, it feels great. You know, I can feel the pressure, but I can see how that can pull down into my foot, which totally makes sense now. So if I pull that foot up and in and around, I can start actually flossing the muscle underneath the pressure of the ball as it pushes into my fibula. That's going to help to relax and lengthen those muscle fibers, especially after we let it sit there for about 30 seconds or so. So you can do that with oscillations, and I would internally rotate. So invert the foot up towards the ceiling, and then let it go into a kind of a slack position, and then just repeat that several times. Once you've done that for maybe about 30 seconds or so, I would take a break, let it go, and then we'll get right to our stretch. So that would be a soft tissue active release technique using a fast release ball on the peroneals, and you would do that before you get into your stretch, which we'll do right now. Okay, so now we've done that soft tissue technique to relax the muscles.
Right.
Now we want to stretch it. Okay, so how do you stretch it?
Yeah, there is a really good way to stretch the muscle by basically doing the opposite of the action of what the muscle does. Meaning, we'll show you, but you're going to take your foot and you're going to bring it down and inwards to allow that outer side of that leg to lengthen and stretch.
Very cool. So you're going to need a bench or something to sit on so you can basically just support your weight so you'll get a better line of pull when we go into that stretch, right?
Yeah.
So let's do it. So grab a bench and let's get started. Okay, so now Hunter's sitting on the bench, looking pretty.
Yeah, right.
Doing
Thanks
good.
a lot.
Okay. And now we're going to stretch that muscle out by doing the opposite of the muscle action, right?
Right.
Okay, so Ashley, what do we got to do here?
So when you're at home, of course, you can use a chair, and you're going to cross your leg over, and then you're going to take your hands and clasp your foot. And then what you're going to do in this position is bring your foot towards the ceiling, but kind of inward, so that you are basically pointing your toes and pointing your ankle as you're pulling. And you can see that then there's a good stretch on that outside of the lower leg. How does that feel?
Definitely feel it.
Awesome.
Yeah, and it's one of those where you kind of have to pull in a little bit more than you would expect to get that feel.
Yeah.
Right? So if you pull in, not to the point where it hurts, but enough that you can actually start feeling that give on the lateral edge of the fibula, right? Yeah. So
It's amazing how much you can feel it wrap into the foot.
yeah.
Yeah.
I notice when I do this too, when I stretch through the peroneals, it makes my ankle feel so good, and then unrelated issues that I feel in my foot seem to go away, which
Nice.
obviously, yeah, it's a fantastic stretch, and it's one that's underused in my opinion. All right, so you would do that for about 30 to 60 seconds, right, until that muscle starts to lengthen. Now remember, the relationship that you're looking for is a physical release of the muscle. So you should physically feel that muscle start to let go a little bit and give you more range of motion. If you're doing it right, then that will occur. If not, and you're pulling too hard, the body has a tendency to react and to reflexively tighten. So you don't want to do it so hard that you would ever feel a quaking or a distortion in the joint or feel that muscle in pain.
Right, and that's with any stretch. You want to go till you feel the stretch, but it shouldn't be painful, as Ryan noted.
Yeah.
Kind of like pressure, not pain.
Yes, exactly.
Got it.
Yep.
Yeah.
Breathing helps with it too. So remember, as you breathe out, you create this parasympathetic response in the body. Tone of all the tissues in the body start to relax, and it'll help to give you a little bit more of a range of motion. So once we've done that, we're going to go into the activation and get our butt stronger and our middle foot stronger. So let's get to it.
Let's go.
All right.
All right. Okay, so we got those peroneals all stretched out. Now they're compliant. So now we're getting the muscles that are typically underactive to start getting stronger. And this one is a mouthful, abductor hallucis. Did I say that right?
I
Abductor
think
hallucis,
so,
right?
yeah. So basically what these muscles are, and they lie under the foot and they help to support your arch. So they're the muscles that kind of create that arch, and they run all along the bottom there. We also sometimes call them intrinsic foot muscles. So if you think about humans, we're not supposed to walk in shoes. And when we don't walk in shoes, we are strong in these muscles. When we've had boots on, shoes on all winter long, these muscles can get really weak.
So anyways, we're gonna show you how to target those and make them stronger. Let's get to it. Okay, so in order to do this, we're gonna wanna sit down to start, especially if this is the first time that you've actually tried to work this muscle. It's hard to engage for a lot of people, especially, again, because you don't really traditionally use it, right?
Sure.
So what we want to do is take the weight off the body, and we're going to do that by sitting down, and then we're going to start pulling the toe back and down. So if we talk about where the muscle attaches, give some context about why that actually going to flex it. So Ashley, where does this muscle begin? Where does it rotate to or attach to? And how does that
We're
work?
going to use this foot.
Yeah, we can
A little
use
bit more
either
room.
foot.
There you go.
Perfect. So basically, just right below the arch, and then the action of it. So go ahead and flex that toe up. That actually activates the muscle, and then extend these toes. All right, so as you can see, he's actually kind of recreating an arch for himself right now. So he's reinforcing, it's almost as if he's drawing, like doing a tripod movement. So pulling that arch kind of up as that toe is pushing down. All right, so he's working, you'll feel it underneath your arch in those little
You're going to
muscles.
feel it. I'm feeling it.
Yeah, I found with a lot of people when they're doing balance work on one leg, they complain about their foot starting to ache.
Yes.
It's because they're really starting to engage that muscle.
Right.
Right? And that's
Yes.
not necessarily a bad thing when they're
Right.
actually working through it. It means that they're actually developing strength to make that foot more
Right.
stable.
Yeah.
Yeah. So by pulling the toes up, the opposite toes, from the big toe up towards the ceiling, creating some extension of that, it actually creates a stronger impulse or contracture out of that hallucis muscle, right?
Yes, good point.
Yep. And a lot of people can't do that out of the gates.
Right.
I found that on my left side, I had the hardest time getting those guys to do it, but I kept on practicing. And it actually came to life after about maybe 3 or 4 applications.
Yeah, that's a really good point, because you may be trying to do this right now and realizing how difficult it actually is to engage these muscles and do the motion. But I think, yeah, as you practice it more and as you concentrate on starting to activate those muscles, you will get it, and you will start to get those working again for you.
Yeah, that's great. Pull that foot up, hold it for about 6 seconds, and then slowly let it drop down to the ground. So I'm basically slowly relaxing the muscle tension as it would fall to the ground, almost like it would resemble when my foot would flatten out as I step into it, right? So this is something where people have also asked, well, can I do this while I'm running or jogging or implementing it in real life? I recommended that they don't. They try to start in isolation. So flex those muscles, hold it for 6, come down nice and slow to a count of 2 or 3, and then wrap that for about 10 to 15 reps. Do that maybe 1 or 2 times. Give your muscles a little bit of a break in between, 45 seconds to 60 seconds. Do it a second round, and then we would go into our integration. Okay, so now that we've released those overactive peroneals and we've activated the hallucis muscle, we want to basically put that foot into work with the rest of the body. And this is how we integrate it, by making the hip work and the foot work in the relationships that are responsible for keeping everything stable.
Yeah.
Right?
Perfect.
Yeah, so what we're going to do is practice a movement that's going to recruit his lateral rotators and his glutes, primarily the glute medius, along with keeping that functional arch to hold his foot nice and stable. And this we're going to call basically an abducted, adducted hip, basically single leg balance, right? So for those of you who are maybe feeling a little unstable, nursing an injury, or dealing with a prior trauma, this may be too much for you, so take it with a grain of salt and maybe work up to it. We can reduce the range of motion, and we'll give you a couple different variations so that you can choose the one that's appropriate for you. So let's get right to it. Okay, so the truth of this is that we want to work on the muscles that are going to help us from basically pronating. Pronating is when the foot falls in, right? Now, when pronation happens, like Ashley described at the outset of the program, it leads to an internal rotation at the ankle. The femur will fall in with it, and it'll stretch out these muscles up at the top of the hip, especially the gluteals, right? So what we want to do is learn how to put that foot musculature into play with the gluteals at the same time, teach the brain to accept that relationship so that you can do it in your everyday activities, right? So in order to do that, Hunter, with his gigantic feet and legs, are going to try his best to keep upright posture. And again, he may be challenged with this and struggle with this, and that's okay. That's kind of the learning curve. You guys may be doing the same thing. So just understand that if you need to reduce the range of motion, you don't have to go as far through these movements, or maybe even brace yourself. Ultimate goal would be able to take away that bracing mechanism so you teach your nervous system how to do the work, but you can always work up to it. Okay?
Yeah.
Okay.
Yep. So Hunter, you're going to start with putting that foot down. He's going to be on his right side. And remember, you'd be all on the same side of the body. He's going to grip the ground. And he's basically going to step his opposite foot across the body and basically translate his hip off to the side. And what that's going to do is stretch out those gluteals, take it through a full range of motion. He's going to keep his foot gripped, so he's keeping that arch. And then he's going to rotate, stack his weight, and kind of sink and pivot open. So while doing this, he's going to try to keep his knee tracking with his second toe, so it's not dumping in or out. He's not letting it roll in. It's called valgusing or rolling out, varicing away from the midline. And he's going to try to take that hip through that nice internal and external rotation at the same time.
He isn't necessarily doing the toe down, other toes, the first toe down, other toes extended. Now he's just thinking about gently lifting up and in that arch. So he's thinking of that doming technique and keeping that the entire time. What he doesn't want to let happen is that foot fall flat. Okay, so he doesn't want that foot and that arch to flatten, because then look at what happens at the knee. So we're starting ground down, but then now we're also adding that glute stabilization up at the higher, more proximal area there too.
Now what you would want to do is try to control the drop of the movement. As he sinks in, it's going to be a nice slow control of movement. Hold it there for a few seconds, and then as he comes up, he's going to try to maintain the feet, not let the foot fall in. You can see he's struggling there. His ankle's starting to do the watusi. You know, he's starting to work pretty hard. Now he's getting fancy. He's getting deeper and deeper.
Sure.
Yeah, he's getting,
I got to show Ryan up a little
getting his
bit.
groove on. He's doing good. So you'd go through about 10 to 20 repetitions of this. It's a slow time under tension. Right? So he's looking at roughly 4 to 6 seconds per rep for about 10 reps to upwards of 20 reps.
Yeah.
So the goal here is not to just kind of power through it and swing and use momentum. Remember, momentum is the destroyer of results. We want to learn how to control it. If you start to see a distortion or deviation from the cues that we gave you, then you may want to unload it or make it less in its range of motion. Okay, we can always go back. Now on that note, we want to close it all off with strengthening the muscles that are primarily responsible for holding that pelvis under, posteriorly holding it without having to rely on the back muscles, rely on the hamstrings. This is going to be the transverse abdominis, deeper of the abdominal muscles. We're going to be on the ground for that. Let's get to it. Okay, so now we're going to go into the strength protocol for the day. Now we're going to make a Herculean jump in terms of biomechanics here, right? So we went from the foot all the way up to the hip, and now we're going into the core. There's a lot of relationships going on, and these can be complicated.
Sure.
So what we want to do is just be aware that the body has to maintain its center of mass, and when as we walk or run or jog, it's basically a controlled fall, right? We have to be able to maintain our base of support under our shoulders and allow our legs to go out and back and forth and engage, right? Now, if we can't maintain that base of support, the way that our legs or appendages move under us could be altered or incorrect.
Sure.
And that can lead to excess pressure into the foot and et cetera, reason why we did all these things tonight. So what we want to do is finish with something that's going to help you to maintain that base of support, but keeping your pelvis in a neutral alignment so we get more extension out of our hip and not so much out of our back. Right?
Yeah, and that's super important, you guys. So a lot of people have worked their core in some way in the past, right? So what is core? What we're going to show you tonight is actually super, super important. It's not only working the core, but it's working the deepest layer in of the core called the transversus abdominis. This basically is an internal corset around your spine, and it's the fourth layer in. So a lot of people work on that six-pack, that superficial outer core, and that looks great at the beach, but it's not gonna necessarily help your back pain or your issues with stability. So we're gonna show you a really great way to get at those deep stabilizers, that TA, transversus abdominis, that deep core tonight.
So first, we want to make sure that we make everything that's not supposed to move, not move. Right? So we want to first get his head to be nice and in a neutral position by keeping his chin tucked and creating cervical flexion.
Yes.
So he's going to tuck his chin and he's going to support his head in his fingertips. A lot of times people will use their pectoral girdle and swing their arms forward and crank their neck into cervical extension, which actually does the exact opposite of what we're trying to help with, right?
Right.
Hands are just support.
Hips are there, right? They're coming along for the ride. The arms are attached to your rib cage, and the rib is attached through your abdominals, and that's what's going to lift up into flexion and create that spinal flexion, okay?
Yeah, so don't lead with your neck. That's not what we want. And think about raising your shoulder blades up off of the mat, but you're using your core to make the movement. And as you're doing it, don't forget to breathe. That's super important.
Yep, so we're going to breathe in as we lift up. The torso is going to come off the ground. And if you want to make this a little bit more challenging, as you're doing that, you can pull the legs into the center, almost like an accordion. And then as you breathe out, you're slowly letting the legs fall down, but you're trying to maintain the lower back in contact with the mat, or just slightly above it. If I could slide my fingers under his lower back, it wouldn't go any deeper than that, and it wouldn't push much deeper into my fingertips. We're trying to keep what would be considered a natural curve of his lumbar spine.
Right.
Okay.
And he's doing a really great job of going nice and slowly and controlled. And a really great key as well is to think about pulling your belly button in towards your spine like you're zipping up tight skinny jeans. All right, so you want to maintain that pulling inward. And just also note, if you feel any back pain with this, then don't bring your legs as far down, okay? You can always modify. You shouldn't feel pain with this one, and you shouldn't feel too much work in the front of those hip flexors as well. So this is a core exercise.
And if you start to see compensations like your elbows falling forward, your neck starting to kick back, starting to heave or swing, right? These are all things that are indicators that you've done the job. Core is tired. Now we're just taking on other groups that are trying to help out. That would be the time to stop, regroup, take a time to recover and relax, and then go back into it.
Perfect.
Right? We would want to do maybe 1 or 2 sets of these, 2 sets ideally. And again, the relationship is about a slow opening of the abdominals, going into extension as the legs come down and the torso comes back. And then we're going to come up in a controlled manner to a count of 2. So we always want to work the opening of the joint in a nice, slow, controlled manner. It's called an eccentric contraction, working against gravity, so that when we come upright and we're walking around, we're able to control that drop of the leg as we walk and we ambulate and go through our gait cycle, right?
Yeah.
Very important.
Yeah, and I think that's perfect, kind of bringing it back to the upright position, putting all the pieces together. We've talked about the feet, the relationship from there up, and now we have the glute and then the core kicking in. So we've kind of given you guys all the building blocks to be really stable and really fit and feel good when you're standing, walking, living life.
Exactly, and there it is. So, guys, we'll let Hunter stay down. You can relax because he's tired apparently. And just remember, we went through 5 different things, and Ashley just basically wrapped it up. We reduce the pressure of a muscle that becomes compensatorily tight, the pronaus longus and the proneals in general. Remember, that is responsible for the eversion of the foot, and it leads to a natural pronation or a flattening of the foot, which can then distort or deviate up the chain into the knee and the hip. That places the muscles up at the hip into a an unregulated position or into a position that's going to be distorted, and then it changes the dynamics of their relationship in the way that they stabilize or move the hip. So we want to make sure that we understand that relationship, put it into play. We reduce the tone of the peroneals, we lengthened them, we activated the muscle responsible for creating the stability, we strengthened the muscle of the foot along with the muscles in the glutes to help create that functional stability, and then we put it all together by going into a crunch That's basically working into the deepest layer of our abdominal muscles, the transversus abdominis. So if you have more questions on this, you can go back to our blog. We go into a more detailed explanation. We all believe that context is necessary to have an understanding so that you make the right decisions in the way that we move, right? And it's very important. Sometimes it gets long-winded. Sometimes it's really sciencey and we use Latin words. And obviously that can be boring. But the more understanding you have, the more equipped you're going to be your own advocate and to correct for these issues and to reduce the pain in the body. So if you have more questions, again, feel free to reach out to us at admin@fluidhealthandfitness.com. Or Ashley, where can they reach out to you?
You guys can reach me on the Pure Yoga website under the tab of Pure Strength. I'm Ashley Labor.
All right.
All right.
That's it. So guys, remember, we go over this each week. We give you a new Design to Move series on another muscle or movement distortion pattern. So make sure to like or subscribe if you like what you heard today. And we'll see you next week for another iteration of these programs.
Awesome. Thanks for having me.
Bye, guys.